Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. Today on the podcast, I'm joined by our deputy editor Nick Bostock.
Hello.
And senior reporter Kimberly Hackett.
Hi everyone.
To talk about the latest news affecting general practice. Coming up, we're talking about Health and Social Care Secretary Wes Streeting's letter to the profession a week or so ago and asking whether what he had to say addressed the BMA's red lines to avert further industrial action by GPs. We'll also be looking at the latest update to this year's GP contract and what that means for staff and GP pay. We're talking about physician associates after their union, United Medical Associate Professionals, or UMAPs, launched a legal bid for an injunction to prevent changes to the role following the Leng review. And we'll be looking at the jobs crisis facing newly qualified GPs, as well as the stresses and pressures facing GPs further along in their careers, and what this all means for the future of the profession. Our good news story this week is about patient satisfaction with GP access. So first up, let's talk about that letter that Health and Social Care Secretary Wes Streeting wrote to the profession earlier this month. Nick, what exactly did he have to say?
The letter from Wes Streeting is interesting for a couple of reasons, both from the point of view of what he's saying and the timing. I think the aim of the letter is, on the one hand, to try to reassure general practice over some of the concerns raised by the 10-year health plan. But it also looks like an attempt to begin to address the list of demands the BMA GP committee set out in a letter to the government last month, those red lines you talked about. On the 10-year health plan part, if you remember, the plan talked about large-scale alternatives to the GP contract. It also seemed to criticise small independent practices and to blame them rather than things like underfunding or understaffing for pressure on general practice. And there were also lines about hospitals potentially taking control of health budgets across entire regions. And all of that, unsurprisingly, created a lot of concern among GPs. The BMA GP committee said that the 10-year plan threatened the existing GP model and continuity of care. So this letter from Wes Streeting looks to be trying to walk that back a little bit. He said the government is serious about general practice, praised the hard work GPs do, and he also wrote that the government is committed to the partnership model of general practice. In a way, that's not new, because the 10-year plan said that where the traditional partnership model was working well, it should continue. But the government has also recently said that it expected talks on reforming the GP contract to cover an update to the partnership model. So there have been sort of mixed messages, and there's been a lot of concern, rightly, amongst GPs. And this letter is an attempt to settle some of that down. But the timing's also important because we're coming up to a deadline the BMA has set for the government. We mentioned that letter from the BMA GP committee to the government, and that letter set out what we've called these red lines, a series of demands broadly around future funding and GP's role in neighbourhoods. And there are just 4 weeks now for those demands to be met. And if they're not, the BMA has suggested that general practice could vote to go back into industrial dispute with the government. So Wes Streeting's praise for general practice, also commitment in his letter to work with the BMA in September to lay the groundwork for the substantive new contract for general practice that the government's promised to negotiate within this parliament. Those commitments also look like part of a charm offensive to try and avoid a return to an industrial dispute. I mentioned the letter confirming the government's commitment to the partnership model. It also talks about the work towards this substantive new contract being about retaining and reforming the practice-based contract for general practice. That's really saying we want reform, but we aren't going to tear absolutely everything up. The letter, it also mentions money the government's put in as part of the 25-26 contract deal. Big new investment, offset in part by big extra costs, but certainly ultimately an improvement compared with previous years.
Does he really answer those concerns from the BMA with this letter, do you think?
The answer is unquestionably no. The BMA's asked for confirmation by the 18th of September of the funding envelope for next year's GP contract and for the big new contract to come. And the government hasn't gone anywhere near addressing that yet. The BMA wanted a commitment too to shift the £1.7 billion a year additional roles reimbursement scheme funding into a practice level scheme, as opposed to the current scheme that operates at PCN level. And there's nothing on that in Wes Streeting's letter. And it doesn't address a call for an emergency practice level fund to end GP unemployment, or a point about expanding indemnity to cover practices sharing data as part of the move to neighbourhoods. Another key point, the BMA wanted an explicit commitment that the government's preference was for GPs to lead neighbourhoods. And although the letter talks about GPs being the cornerstone of neighbourhoods at the heart of these plans, Wes Streeting hasn't made that commitment as things stand.
What does all this tell us about the overhaul of the GP contract that we're expecting during this Parliament? Is this a positive step towards that, or do you think that the profession will be hoping to see a bit more detail about how things are going to shape up by this point? Do you think they would want to hear more from Streeting on that new contract?
I think there are some positives. The government is saying it's determined to work with GPs to develop that new contract. It wants to work with the BMA GP committee. And it's made clear that the contract will be practice-based, that the partnership model isn't being scrapped. For the first time too, we also have a date, September, when talks on sketching out the process and scope of talks on the big new contract will start. Actually, that also provides a bit of a window in terms of maybe providing some more reassurance for the BMA around those red lines that we've talked about before the 18th of September deadline. So that's positive. Having said that, we don't have detail on how much money is available, this funding envelope that the BMA wants, or answers on some of those other key points that GP leaders have asked about. Overall, although I'm sure people would always want to see more detail, it's worth remembering that the government only formally agreed in March to negotiate this substantive new contract. On that basis, perhaps it's not reasonable to expect huge progress to have been made since then.
The other thing that's happened since the last podcast we were speaking on, there's been an update to this year's contract, hasn't there? We've had some more detail on how the additional uplift to contract funding, which is supposed to deliver that 4% pay rise for 2025-26 to GP partners, salaried GPs and practice staff. What do we know about that? Will GPs be getting that pay rise this year?
It looks like many of them will, which makes a change from previous years. Back in February, we reported on the GP contract deal agreed between the BMA and the government for the 2025-26 financial year, so the current financial year. That involved a near £1 billion uplift to funding. We said at the time it could rise further, depending on advice from the Doctors and Dentists Review Body, which advises the government on doctors' pay. And that original deal assumed a 2.8% uplift to GP pay. The DDRB ultimately recommended 4%, which the government accepted. So the government has now put more than £120 million on top of the original contract package to bridge the gap. As we've talked about before, the BMA says that 4% uplift is nothing like enough. And it says that the overall uplift doesn't go far enough to begin to address erosion of general practice funding that we've seen over the past decade and a half. But in previous years, we've talked about the funding coming to general practice falling short of what it needs to be to actually cover the headline pay increase the government's promised. And what's different this year is that accountants are saying the money the government's put in will actually deliver the promised pay rise. So practice may not have seen long-term erosion of funding reversed, but at least this year, most partners shouldn't have to cut their own drawings to cover passing on the pay rise to staff, for example, and they should actually see the 4% uplift to their own pay as well in most cases. So one caveat here is that variation between practices means that some are going to do better than others out of this deal. Practices with the higher staff costs are likely to struggle more to cover the 4% uplift. And it is worth mentioning at this point that you spoke to Richard West on last week's podcast about why dispensing practices, for example, are among those that may not see the benefits some others do, in part because of staff costs. But in any case, for most practices, this year's funding matches what's been promised to a far greater extent than it has in recent years.
Yeah, well, at least that's a bit of positive news there. Before we move on, a quick message from our colleagues on MIMS Learning. In-person learning is a vital part of keeping up to date, enabling GPs and other health professionals to learn with colleagues, ask questions of expert speakers and benefit from networking. MIMS Learning's event page gives you details of the general practice-focused learning events, providing you with practical take-home points for your practice, along with CPD certification. Visit mimslearning.co.uk/pages/events to find out more. So we talked on the podcast a few weeks ago about the results of the Leng review into physician associates. That independent review, which was commissioned by the government, was carried out by former NICE Chief Executive Professor Gillian Leng. Among other things, it concluded that physician associates should be renamed physician assistants, that they should not see undifferentiated patients, and that it would in future need to spend at least 2 years working in a hospital before taking on a role in primary care or mental health. The government accepted all of the recommendations, and NHS England wrote to employers setting out the immediate steps they needed to take to factor in this advice. The union, United Medical Associate Professionals, or UMAPs, which represents physician associates, has taken issue with the review's recommendations and in recent weeks launched a legal challenge against it. Nick, before we get on to the legal challenge, we've mentioned that update to the GP contract already, which brought in the extra money for the pay uplift. As part of that, NHS England also updated the network contract enhanced service, which is the contract that governs how primary care networks operate. That was updated to include increases to various funding streams and the salaries PCNs can claim for staff employed under the additional roles reimbursement scheme. But it wasn't updated to include any of these changes related to PAs that NHS England said practices and employers should bear in mind, was it?
It wasn't. So, interestingly, an update from the BMA England GP committee after the Leng review suggested that it was expecting the network contract DES text to be updated. The GP committee update said that following the Leng review, ARS physician assistant and apprentice physician assistant role descriptions have been amended. And it said those new descriptions had been shared with the committee for comment. But as you said, when the updated DES actually came out at the end of July, a fortnight after the Leng review, the job descriptions hadn't changed at all. It still referred to physician associates, not physician assistants. It still contained wording suggesting staff in those roles could operate as first contact health professionals seeing undifferentiated patients. And from what we understand, that change didn't go ahead because of a legal challenge from UMAP, the union that represents PAs.
So what exactly was the legal challenge aiming to achieve?
There's a few elements to this. First of all, UMAPs is trying to secure a judicial review to challenge the implementation of the Leng review recommendations overall. And it says the government, NHS England, failed to properly consult medical associate professionals about changes that are going to have a big impact on the scope of their work and on their existing contracts potentially. It also says the government hasn't carried out a proper cost-benefit analysis of the changes and that information that led to the conclusions in the Leng review may have been biased. So that judicial review could take a while to get going. And in the interim, UMAPs tried to secure an injunction to prevent Leng review advice being implemented. So it basically wanted a freeze until the judicial review was complete. We found out at the end of last week that UMAPs had lost that case, so they haven't secured an injunction in the end.
So what have UMAPs said about this now? What happens next?
In terms of next steps, UMAPs is pressing ahead with this bid to secure a judicial review, and it's also issued a warning to employers, urging them to await the outcome of that judicial review still before making any changes to PA roles. And what the union said was that any employer that hastily presses ahead with implementing the recommendations while the judicial review is pending will face legal action from UMAPs.
Do we know what NHS England and the government think about this? Have we had any response to this from either of them?
So after UMAPs lost that bid for an injunction, NHS England put out a list of frequently asked questions, an FAQ document that tries to cover points around what organisations employing PAs should or can do now. As you touched on a minute ago, NHS England sent out a letter to NHS organisations straight after the Leng review was published, telling them to start calling PAs physician assistants immediately, make sure they didn't triage or see undifferentiated patients. But this FAQ document is a bit more circumspect. It says NHS England is working with unions and royal colleges to decide how Leng review advice should be implemented, and that when it comes to actions recommended in its earlier letter, employers should review these in line with clinical guidance and protocols and their own organisational policies and consult with local trade unions on how any changes can be applied with regard for employment law and in line with clinical governance processes. I think it's worth pointing out here as well, there's been some questions about whether NHS England was rescinding that original letter. As far as we know, it hasn't rescinded the original letter telling practices to take certain immediate actions. But this FAQ document says the health service is also bringing together an expert group to develop clinical protocols for PAs. It doesn't say job titles should be changed like the earlier letter did, but it does say that NHS organisations should take immediate action to ensure patients are not under the misapprehension that they've seen a doctor when they see a PA. And it also suggests a process for considering what PAs should be paid.
So what does all this mean for practices and PCNs that are employing PAs? Is there anything they should be doing? You've been speaking to some LMC leaders about this. What did they have to say?
So what one LMC chief executive said to me was that he felt practices who have PAs or PCNs ultimately are walking a tightrope. On the one hand, they've been told to make changes to keep patients safe, such as stopping PAs seeing undifferentiated patients. And on the other hand, they're facing the threat of legal action over changes to PA roles. The sense I got from that LMC is that practices do need to make some changes. The FAQs highlighted the importance, like I just said, of making it absolutely clear to patients when they see a PA that they're not seeing a doctor, for example. And this LMC also felt that PAs should not see undifferentiated patients in line with the Leng Review advice and advice from the BMA and the RCGP. But things like changing pay or terms and conditions for PAs, the sense is that all of that is best left until after this judicial review, if it goes ahead, is completed. So practices need to wait, watch what happens with that, and in the meantime, read that NHS England advice carefully, as well as fall back on support from organisations like the BMA and, on any employment questions. The BMA has called for more clarity from the government and NHS England too, so there could be more to come on this, even before any judicial review might take place.
It's definitely a story that's going to keep developing, isn't it? So we'll be keeping an eye out for what happens with that. One of the main stories we've been reporting on over the past 2 years or so is the jobs crisis in general practice. GPs are struggling to find work or enough work, in the main because practices simply can't afford to recruit them. This has come at the same time as government efforts to increase the GP workforce included a significant expansion in GP training places. And so now there are record numbers of GP registrars completed training each year, but real concerns about whether they have jobs to go to. Kimberly, let's bring you in here because you've been doing a lot on this story over the last couple of years. We got some data recently from the RCGP about the scale of the issue this year, didn't we? What did the college have to say about this?
Yeah, so the RCGP gave Nick a first look at some of their data, and the college estimates that around 4,200 doctors will qualify as GPs this year, and a large number of these will actually CCT this month. And soon after the RCGP released this data, the BMA also said that around 3,000 GPs were to CCT by the 8th of August. Now, the college said it was happy to see a rise in the number of GPs qualifying, and the predicted total for 2025 is up around 47% compared with 2020 when 2,866 GPs qualified. But the big concern from the college is that there aren't enough jobs available for newly qualified GPs to go into. It says that registrars have told them they are struggling to find GP roles, and practices have been unable to take on new GPs due to a lack of funding. The college said that they don't believe the ambitions of the 10-year plan and moving care from hospitals to the community will be possible without GPs delivering the extra work. And the BMA also raised their concerns about unemployment in a letter to the government. The union asked to meet with the government to discuss solutions to the GP job crisis, because at the moment, many newly qualified GPs face uncertainty with no substantive role to move into.
You speak to GP registrars and newly qualified GPs quite a lot, and it's an area that you've really been following in recent months. And you've been looking at specifically at how this has all affected this new cohort of GPs who are qualifying. What have you found?
Yeah, so I spoke to a GP trainer, and he told me that there are a lot of roles available at the moment, but many are part-time or maternity cover. He knows of some newly qualified GPs that have had to take on 2 ARRS GP roles at different PCNs in order to make a full-time salary. He actually described the working lives of newly qualified GPs as fragmented because, in previous years, GPs would often head straight into full-time salary jobs, whereas now they aren't. And he said that registrars are looking for work in some cases up to 5 months before they CCT because it's so hard to find a job at the moment. Whereas normally registrars would start looking for work perhaps a month before they qualify. Now, all this uncertainty in the job market is not surprisingly having a real knock-on effect on the registrars. The trainer said it has been very difficult for some of them psychologically, and it's been really challenging for them as well. So while many of the ARRS roles have been advertised as part-time work, which isn't ideal, what he did say was that these roles have helped to keep newly qualified GPs stay in the area that they trained in. Now, it could be that we see more ARRS GPs employed this financial year than we did last year. I say that because of a response to a Freedom of Information request that I made to NHS England. And it revealed that in 2024-25, there was a total underspend of £47.9 million from the £82 million allocated for the ARRS GP employment scheme. And various leaders have suggested that such a big underspend shows that the scheme hasn't attracted enough newly qualified GPs into the role, and therefore it isn't really working. And we know it's received criticism due to the low salaries and the possibility of GPs having to work across several practices, which hasn't been received well by many newly qualified GPs and more senior GPs. But one LMC told me that they think this financial year could see more PCNs want to employ ARRS GPs because they now have a greater awareness of how to use the role in general practice. And there is also the increase in salary, which might make the job more appealing to newly qualified GPs. So hopefully there will be more newly qualified GPs able to find work soon.
We'll have to keep an eye on those figures, won't we? Because obviously there's a lot more flexibility this year with the ARRS as well around how practices and PCNs can spend that money. It's not that rosy for GPs further along in their career either, is it? Nick, you've written a couple of stories recently that suggest things are quite tough. I mean, some of this is all very familiar, isn't it? About burnout, GPs feeling they're quite like to leave frontline patient care in the future. They're things that we've written about over the last number of years. What were these latest stories you wrote on?
Yeah, so I mean, just touching on what Kimberly mentioned just now, I mean, she talks about the psychological pressure on newly qualified GPs, and that's right at the outset of their careers, obviously. The GMC put out its annual report on the state of the medical workforce this month. And the line that stood out from that was about GPs facing extreme and prolonged pressure. The report said doctors across the board are under real pressure, so across the NHS, but that GPs seem particularly affected. Around 29% of all doctors are struggling with workload, for example, according to the GMC report, but among GPs, it's 44%. About a third of all doctors are dissatisfied, but among GPs, it's nearly half. So pressure on general practice remains really significant, and that's been a theme for some time, and it's obviously out of whack with the level of pressure and dissatisfaction and so on among the rest of the medical profession. Obviously, all that pressure links to problems like burnout, decisions to leave the profession. And this ties in with a piece of research from the University of Manchester that found 1 in 3 GPs plan to quit patient care in the next 5 years. That research found that burnout and low job satisfaction were the biggest factors driving those plans to leave the profession. So we've talked about all these doctors coming into the workforce, but these figures show just how much more work there is to do on retention of existing GPs.
You wrote an opinion piece for the website recently about the importance of addressing those workforce challenges, didn't you?
Yeah, the point I was trying to make was really just that the government has set out all these grand plans for the health service in its 10-year plan. But if it can't guarantee something really basic, which is having enough GP bums on seats to see patients, then it may not count for a lot. As we mentioned, the RCGP says 4,200 new GPs will CCT this year. But they're coming into a workforce where thousands of GPs are already unemployed, struggling to find enough work. The government said it's created lots of new jobs through the ARRS, but it actually can't provide a really clear picture of the overall GP workforce at the moment because it hasn't been able to combine those ARRS recruitment figures with the overall GP workforce data the NHS publishes every month. So no one really knows how the actual total number of GPs in the NHS workforce has changed over the past year. We know from the GMC and this other study that existing GPs are being driven out of the profession by huge pressure. That pressure could be alleviated by bringing in the thousands of available GPs, but that isn't happening to the extent that it should be because many practices can't afford to recruit. The government says it wants to ease pressure on general practice and to improve access to GP appointments for patients. And the simplest solution to that isn't alternative GP contracts or turning hospitals into integrated care organisations. It's finding a way to hire those thousands of available GPs and get them into practices right now.
Clearly, retention is just as important as recruiting new GPs. In recent years, it seems things have significantly improved with the numbers of doctors applying for GP training. That has been a real issue in the past, not enough doctors even applying for training. But now, obviously, we've got this awful situation where there are no jobs for people to go to. And we know that retention has been a major problem in recent years. We've spoken on the podcast before about an updated NHS workforce plan that's due to be published later this year. And that is going to reflect the changes envisaged in the government's 10-year health plan. The government has already promised to recruit thousands more GPs. So hopefully there'll be more information on what all that means in the workforce plan. And that's surely going to have to include measures to make sure that these GPs who go into training actually have jobs to go to when they finish. Obviously, the real concern is that if this problem continues for much longer, it's actually going to start putting off young doctors from applying for GP training in the first place. But the workforce plan will also need to include concrete measures that set out how to improve GP retention. The RCGP was highly critical of the current workforce plan when that was published by the last government a couple of years ago because it contained nothing really about retention of GPs. So the college and lots of GPs will be hoping that this updated version of the plan this year will rectify that omission, I'm sure. Before we go, we've just got time for our good news, which this week is about patient satisfaction with access. Nick, what's this all about?
Shortly after the general election last summer, the Office for National Statistics began conducting a survey that looks, among other things, at patients' experience of general practice. And that survey has been running for about a year now. And what it shows about general practice is really positive, especially when you consider the context that we've just been talking about in terms of pressure on GPs. The first wave of the survey, and it's called the Health Insight Survey, was carried out between the end of July and the start of August 2024. That showed about 2/3 of patients rated their overall experience of general practice as good. But in the latest figures, which cover the end of June this year to the start of July this year, nearly 3/4 of patients rated their overall experience as good. So there's been a big improvement. When it comes to the proportion of patients who say contacting their GP practice is easy, the improvement is actually similar and slightly larger. So again, it's a really positive sign about the direction of travel for general practice over the past year.
Well, that's it for this week. Thanks so much for listening, and thanks to Nick and Kimberly. I'll be back next week when I'm speaking to Adrian Dowd, who's a director of the Institute of General Practice Management and a managing partner of a practice in Lincolnshire, about the challenges facing practice managers and what's needed to run a successful GP practice in the current climate. So please do join me then. In the meantime, don't forget you can keep up to date with all the latest news and access lots of other resources on our website at GPonline.com.